Well, I wish I could say that for LISC it started 35 years ago when we first began our work to revitalize low-income communities, but the real answer is that it really is only within the past couple of years that we've realized that our work really has a big role to play to improve health and well-being. And, you know, we certainly didn't figure it out on our own. We really owe a lot to some of the early adopters like the Federal Reserve Banks and the Healthy Communities Initiative that you and Jocelyn have talked about. And, you know, also I think the work of the Robert Wood Johnson Foundation and its vision to create a culture of health in every community in the country. And I can remember when LISC's President Michael Rubinger was reading a report from the Foundation's Commission to Build a Healthier America, which is a national group of prominent public and private sector leaders that is convened by the Foundation to suggest strategies for improving health for all Americans. And he was reading the Commission's recommendations for how to improve health outside of the healthcare system, and was looking at everything from housing to transit, recreation, early childhood education, and safety. And he said, wait a minute, that's LISC's annual report. And I think for me, you know, on a personal level, there have been light bulbs going off for the last 2 years. I definitely remember the first time I saw the kind of heat maps that Jocelyn described, and realizing, looking at those twin images, that, you know, the people in low-income communities that we're serving that struggle so much to find good housing, education, jobs, and food are the very same people struggling with their health. And, you know, a few years ago, I was not regularly using the term social determinants of health, which I now understand are the physical, social, and economic factors in a person's community and life that have such a significant impact on their well-being. But today it's part of my vocabulary because in another aha moment for me, I learned that only 10% of health and longevity relate to medical care that you receive. And so that means community developers have a really big role to play in addressing so many of the non-medical barriers to health, because we can help put in place everything from stable housing to grocery stores and health centers, playgrounds, and safe places to walk. All of the things that are needed to create neighborhood environments that give people the opportunity to lead a healthier life.